Today's topic is one most older men wish someone had explained years earlier. Because after the age of 50, potency doesn't just change, it becomes unpredictable. Some days, everything works perfectly, and other days the body feels unresponsive, slow, or simply weaker than before. Many men blame age, low testosterone, or even fear something is seriously wrong. But often, the real cause is a neglected pelvic reflex point that controls blood flow, nerve activation, and erection stability. And the best part, this spot can be stimulated in just 1 minute with a simple massage technique. By understanding this point, older men can restore responsiveness, improve circulation, and regain confidence naturally without pills or complicated routines. For millions of older men, the biggest challenge isn't desire. It's the body's ability to respond the way it used to. Erections become softer, slower, or inconsistent. Morning strength fades, potency drops without warning, and even though the mind still feels young, the physical response doesn't follow. This creates frustration, embarrassment, or the fear that something is permanently broken. But here's the surprising truth. More than half of these issues are linked to one overlooked problem: poor pelvic circulation and weakened neural signals. There is a specific spot in the pelvic region that controls this entire system, like a switch. Over time, sitting, aging, prostate pressure, and reduced blood flow cause this area to tighten and become unresponsive. When this reflex point becomes stiff, erections weaken. When it becomes active again, potency returns, often faster than you'd expect. And that's why today you'll learn exactly where this point is, why it shuts down in older men, and how massaging it gently for just 1 minute can restore blood flow, nerve function, and natural sexual strength. This is the kind of information older men should have been taught decades ago. There is a small but powerful reflex point located between the base of the pelvis and the soft tissue just behind the scrotal area, and it plays a major role in how well blood flows into the erectile chambers. Most men go their entire lives without realizing that this spot influences circulation, nerve sensitivity, and even the strength of pelvic floor contractions. As the body ages, this point becomes tighter, less responsive, and more compressed from years of sitting, prostate pressure, reduced movement, and weakened muscles. When that happens, the natural erectile reflex slows down because the surrounding nerves lose efficiency and the blood vessels struggle to expand fully. By stimulating this point, older men can help release tension in the pelvic floor, improve the function of the pudendal nerve, and increase warmth and blood flow toward the area responsible for potency, allowing the body to activate a response that often feels noticeably stronger and more reliable. As men age, the arteries supplying the pelvis gradually lose elasticity, making it harder for blood to rush in with the same force it once did. Even a small reduction in circulation can have a noticeable effect on erection firmness because the erectile tissue depends on rapid, high-pressure blood flow to expand fully. Years of sitting, reduced physical activity, mild prostate enlargement, and increased tension in the surrounding muscles all contribute to slower circulation in this region. When the pelvic floor becomes stiff or weak, it fails to push blood upward effectively, and this leads to softer, shorter-lasting erections. Many men mistake this for a hormonal problem, when in reality the issue is often mechanical, a simple lack of oxygen-rich blood reaching the tissue that needs it most. By improving circulation and releasing pressure around these vessels and nerves, the body can regain responsiveness and restore strength that feels lost but is actually just dormant. The 1-minute massage technique works by stimulating the reflex point that connects directly to the pudendal nerve and the pelvic floor muscles responsible for initiating an erection. When gentle circular pressure is applied to this area, the surrounding tissues begin to relax, allowing blood vessels to widen and nerve signals to travel more efficiently. This simple stimulation helps wake up a pathway that often becomes sluggish with age, especially in men who sit for long periods or experience chronic pelvic tension. The technique also increases warmth in the region, which is a sign of improved circulation and can retrain the muscles and nerves to respond more quickly. With consistent practice, the body begins to react automatically, making erections easier to achieve and maintain because the reflex that triggers them becomes stronger and more active again. Over time, certain everyday habits quietly interfere with the potency reflex, weakening the body's natural ability to respond. Long hours of sitting compress the pelvic floor and restrict blood flow, creating stiffness around the nerves that control arousal. Chronic stress keeps the body in a state of heightened tension, which tightens the muscles surrounding the pelvic region and disrupts the signals needed to trigger an erection. Extra weight around the abdomen pushes downward on the pelvic organs, further limiting circulation and nerve sensitivity. Even mild prostate enlargement can add pressure to the area, slowing the reflex that once worked effortlessly. These factors build up gradually, making erections feel less reliable, not because the body is failing, but because the pathways involved have become blocked by tension, compression, and reduced activity. Stimulating the key reflex point helps counteract these effects by releasing tightness, improving blood movement, and restoring the responsiveness that aging and lifestyle habits tend to diminish. As you've learned, restoring potency isn't always about medication or complicated treatments. The body already has built-in systems designed to support strong, reliable performance, systems that simply become less active with age, stress, and everyday habits. By massaging the specific reflex point and reactivating the pelvic nerves, you're giving your body the stimulation it has been needing but no longer receives naturally. With consistent practice, improved circulation, better nerve signaling, and stronger pelvic control begin to work together again, creating a noticeable change in confidence and function. Your body is capable of far more than you may realize. It just needs the right guidance to return to form.